The exploitation of the Dalits people, formerly the untouchables of India, is a growing concern. The movie Slumdog Millionaire gave broad exposure to this human rights issue. And before Hollywood brought their plight to our attention, we were moved by a champion of the Dalits right here at Crossroads with Dr. Beryl D'Souza, who has appeared time and time again on 100 Huntley Street. Courage, passion for the marginalized really runs in the family. Well, Dr. Beryl D'Souza is the daughter of Joseph D'Souza. She leads the newly emerging and multifaceted Good Shepherd Healthcare Initiative, a stream of the India group of Operation Mobilization Ministries, and she is here in the studio to talk about the situation in India. Welcome, Beryl.
Thank you, Jim.
You're an awfully young-looking woman to be a pediatrician. You must have started when you were a teenager.
Absolutely. When I was 5 years old, don't you know Indians are very smart?
Very smart indeed. What's it take to become a pediatrician in terms of years of study? I mean, if you count your med school and then the specialization.
Yes, it takes on an average about 8 to 9 years to become a pediatrician.
Now, you wanted to become a pediatrician because you wanted to be wealthy.
That's right.
Have you become wealthy?
Yes, I have, in different ways, though.
In a different way. What is that different way?
Well, I have become wealthy in the work that I'm doing and getting to see the most remarkable hand of God at work. We are seeing amazing things happen in terms of healthcare, in terms of human rights, in terms of the hand of justice happening in the community amongst the Dalit people.
Now, for many of our viewers, the word Dalit is a new name. They're more familiar with untouchable. No longer are people in India referred to as untouchables, right?
That's right.
But the Dalits represent about 300 million?
That's right, about 250 to 300 million people. That's right, so it's a very large number of people.
And these are people who are living at or beneath the poverty line, right?
Right. The Dalits are a synonym to the India's poor people. So when you say poverty in India, what are you really talking about? If you actually look at what societal structure is there and what the poverty, the people who are poor are made up of, you'll realize that more than 70 to 80% of them will be Dalits, the others will be tribal and other lower castes. So it's just a synonym with the poor in India.
And what kind of a condition of life do they face? Do they have access to health care? Do they have access to social services? Do they have access to hospitals if they need them? Things like that.
Yeah. Majority of the Dalits today are still living at a very below human, below dignity standard of living. They struggle every day to access food. The largest number of malnourished children in India, some of them facing acute starvation, are still among the Dalit communities. Access to health care, access to education, access to every human right is a challenge for the Dalit in today's India, in today's prosperous India.
Yeah, and India really does appear to the world to be quite a prosperous subcontinent. I mean, we're watching the Commonwealth Games right now on television, beautiful venues, beautifully dressed people, healthy looking people. It's hard for many of us who have exposure to India through the media alone to think in terms of this underclass of poor people. And it's not just poor people, you're also working, as I understand it, with what we would call temple prostitutes.
That's right.
Tell us about that.
Well, the practice of temple prostitution is officially banned by the Indian government, and I must add that the Indian government has been very proactive in outlawing the practice of temple prostitution, or devdasis as they call it. Having said that, that's become a cover-up for an entry into the human trafficking business, especially in northern Karnataka, Maharashtra and Andhra Pradesh, where young girls are dedicated to the practice of being a devdasi and then instead are finding themselves lured into the brothels where they're abused, exploited on a regular basis every day of their lives until they're finished out of the business.
And so how do these priests gain access to these little girls? Because many of them are little girls, right?
Yes. Well, what happens is this practice again exists in very rural, very impoverished, desperate situations in the villages of northern Karnataka, Maharashtra, Andhra Pradesh, where culturally it has been sanctioned that this is a practice of life, where it is seen as a blessing to dedicate your girl to be a devadasi. And the middlemen in the land, the businessmen, the ones who are influential, are able to convince families who are in desperate poverty to sell their daughters to be a Devdasi or to promise them jobs where they're actually lured into the human trafficking, commercial sexual exploitation business.
I've heard that some of these young girls are actually injected with hormones to speed up their puberty. Is that true?
That's right. The human trafficking issue in India is really huge and really heinous if you look at actually what is happening, where girls are being bred to enter into the flesh trade industry, where they're injected with oxytocin, a hormonal agent, where they have an accelerated puberty so they can begin at about 10, 11, 12 and into the flesh trade business.
And a little girl gets pulled into this. How many men in a day would she be servicing, as they say?
In her prime, she would see about 40 to 50 men a day.
40 to 50 men a day?
40 to 50 men a day.
Now, you're a pediatrician. You see some of these little girls. What are you seeing?
Well, we see various levels of physical ailments. We see physical abuse, beaten up girls with bruises, and of course the whole spectrum of sexually transmitted illnesses, including HIV and AIDS, pregnancy, teenage pregnancy.
And some of them bear babies. Do any of them suffer fistulas?
Yes, they start by, normally they would have about 2 or 3 children, so by the time they're in their 20s, early 20s, they'll be having fistulas because, again, they don't have access to health care. They deliver in the villages, there's nobody to provide for them. They really struggle at every level imaginable.
So tell us what you're doing. Tell us about your work.
Yes. Well, I would like to add that we're working with various organizations on the ground. Some people from the government, some people from secular organizations, all of us realizing that the situation of the Dalits is a huge problem. As our Prime Minister has said, the Dalits, one of the largest problems that we have in our country is the fact that we have the exploitation of our Dalits. And so there are so many like-minded organizations like us who are working together, where we look at providing economic development, education, English medium education, where our children are given an opportunity to enter into India's mainstream marketplace. English is the language of the market in India's economy, and unless Dalit children have that access, they will be forced to enter into a cycle of exploitation, basic primary health care, and as I mentioned, economic development.
You've been doing this how long?
I've been doing this officially for the last 3 years.
Has it been, now you've grown up there, but it must have been a shock to you to see what you saw when you began to work with these people.
Yes. Initially, growing up in middle-class India, you sometimes get, how do you say, blinders on, where you don't really notice, or you see so much of pain and suffering that you become indifferent to it. And I think I had gone through that phase where it didn't really bother me or affect me so much. It was only after I finished medical school and I began my practice in one of these villages in a mission hospital, and I actually got to see real life as it was, where you think after you graduate from medical school that you're going to cure people, you're going to heal people, and you realize it's not about medicine, it's a human right, and there's so many factors involved. There's the justice factor, there's the nutrition and whether they have access to good food and water, and then the whole societal structure, the caste system that actually predominates access to all these major human rights affects the access to health care, and that really challenged me to respond in an appropriate manner.
Now, do you